Hey everyone, so here we'll be doing a Graston technique or myofascial scraping on the erector spinae. So these are the muscles that are traveling on either side of your spine. So how to find that, you just go to dead center of the spine on that bone and then just drop off and you'll feel almost like a muscular tube going down. So for this, we'll be starting with a broad tool, just scraping up and down the length of the muscle right here. We're first going to make sure that there's a little bit of lotion right there to decrease any kind of friction pressure. And then just moving up and down. Usually some redness starts to appear almost immediately, especially if that muscle is really tight or if the skin on top of the muscle is pretty adhered. And going up and down. You may even see some red dots start to appear at times, but they shouldn't hurt too much. Now, through the tool, what I'm feeling for are almost kind of like Rice Krispies, and you can think of those as like adhesions between the skin and the muscle. And so we ideally want that skin and muscle moving smoothly past each other, because if it's not, that adhesion can actually change the function of the muscle itself. Basically, if there's a little tug on the muscle, it's going to change how it works. So we want to try to reduce it as much as possible. All right, so after doing some scraping on tread, I've identified some of the tighter spots kind of based off of the redness. That's a pretty good indicator for where things are tight. And so we'll be using a bit more of an aggressive tool right here, using a bit more pinpoint pressure, trying to really dig into that spot right there. And so usually scraping, we would take a little bit more time, a bit longer than this example right here. But even in the short little bout of time, we're able to see some changes here happening in the tissue. And so this is telling us like, okay, so we have some adhesion. So between that skin and muscle, that needs to be released to improve functionality, because usually this adhesion is building up because of chronic overuse. So in Trev's case, he's a CrossFit coach and owner, so he's doing a lot of heavy barbell lifts, clean, snatch, front squat, deadlift, and so he's using a lot of these muscles of his back. So the more that we can improve the function, the healthier he's going to be and the harder to kill as well. All right, and so that is a Graston technique, also called myofascial scraping release for the erector spinae.